I'm Matt Smeltzer. I'm Associate Professor of Epidemiology at the University of Memphis School of Public Health, and I do a lot of work in lung cancer quality, uh, early detection, and staging. And this abstract at World Lung was looking at the 2024 biomarker survey that we've been conducting this year. IASLC and IASLC partners in thoracic oncology have been sponsoring this work. And I probably have to start with, as you mentioned, the 2017 survey. So in 2017, really, we wanted to understand the landscape around biomarker testing globally and how are we doing with testing? What are the processes around testing? What are the barriers to optimal testing? And so that survey was actually conducted in 2018 and then subsequently presented in 2019. And we really found that cost and access to testing were major barriers to optimal biomarker testing. We found that about 40% of respondents said they thought less than half of individuals in their country received biomarker testing. And we also, in that survey, so we identified some process issues. Timing was also a major barrier. So can we actually get the biomarker results back in time to conduct the test? And also sample quality. So sometimes we try to conduct the test, but actually the biopsy is not of sufficient quality, and the pathologist can't actually run the biomarker testing. So all those different things that could happen. And so we found in 2018 survey that really testing rates were suboptimal. We found some barriers that needed to be addressed, and we really found that there are issues globally with this, and so it's not just one area or the other. It's not just one setting of care or the other, but a lot of people have issues with making this happen in an optimal way. So with 2024, we did this survey this year, and both conducted it and presented it this week, this year in 2024. And we really found the point was, can we see how we're doing now? Have things improved in terms of the perception of testing? Are the barriers the same or are they different? And of course, since 2018, we've had ADARA and all these other great trials read out where now the NCCN is recommending biomarker testing at early stage lung cancer for at least EGFR and ALK, and PD-L1 probably should be tested in most early stage patients as well. And so we really need biomarker testing for almost everyone with lung cancer now, and that is different than what the landscape was in 2018. So this survey, we wanted to do that. We also wanted to and see, are there differences in early versus late stage, and also can we drill down more on the barriers and try to identify a little bit more solutions to actually fix these barriers. So let me tell you a little bit about the results that we found on the 2024 survey. So we had 1,677 respondents across 90 countries and 14 disciplines. And we really had good representation for the different regions of the world. And in addition to this report out, which covers the whole world, we're also going to be reporting out regional data and submitting to some regional meetings to try to share more specific regional data. But what I have had this week at World Lung is the overall data. And this time we started with focus groups and in-depth interviews. We took actually a mixed methods approach this time so that we could try to talk to key opinion leaders and different people out in the field in different regions to make sure we truly understood what to ask on the survey. And one major takeaway from those focus groups was that really there's been a paradigm shift in the way biomarker testing, the way we should think about biomarker testing in lung cancer. And it's no longer a nice to have, but it's really a must have for almost everybody with lung cancer. And so we really want to emphasize this shift and try to promote, when we think about awareness around biomarker testing, that really patients need this testing done in order to make sure that they're really getting optimal treatment for their lung cancer. And so we really need this, physicians really need this information in order to make sure that patients know all the options that they have and can take advantage of the best treatment for them, and also don't take on treatments that don't receive treatments that maybe won't be good for them or won't help them. So we wanted to know how testing has been going. And so I mentioned previously that on the previous survey, we had seen that 39% of respondents thought that less than half of individuals in their country with lung cancer got biomarker tested, and that went up to 67%, which was a significant increase on this survey. So we asked the same question, again. So we took that as a sign that at least the perception is that we're doing better testing, and that was good. Respondents also believe largely that that biomarker testing can improve outcomes. So we had a couple questions around that. And do you generally know who should be getting tested? They had, they're over 90% on those two questions. But when we then pushed back and said, is it highly important that all patients with late stage lung cancer receive comprehensive biomarker testing? And then the same question for early stage, they replied with just 63% in late stage and 29% in early stage, saying that it was highly important. And so we think there's a disconnect. Basically, people say, yes, it can help. It can make a difference in treatments, but maybe we're not totally on board with just comprehensive biomarker testing for every person with lung cancer just yet. So we took that as a sign that we interpret that data that we need to do a little bit more work in terms of awareness and in terms of really this paradigm shift that we talked about before, making sure that we're communicating that well and supporting that with evidence. We also we had a question, we found that 43% reported that they sometimes or often treat patients with lung cancer without the biomarker results. So there's definitely still a lot of individuals that are being treated across the world without having this information. And so there's still a gap in the implementation. But it seems the awareness is improving somewhat, and the testing potentially is improving somewhat. In terms of barriers, so we ask a series of questions about barriers, and the largest barrier remains to be cost, and people cite cost as the number one barrier. And we ask, is there full reimbursement for biomarker testing in your country or in your institution? And 25% did say they had full reimbursement, but 37% had partial reimbursement, and 18% said the reimbursement was so limited that it prevented them really from doing the testing. And but the focus groups, especially around the different regions of the world, highlighted that cost is a complex, multifaceted issue. And so when people say cost is a barrier, they might mean different things. And so I actually think there's more work to do to dig in and say, is what cost? Is it perceived cost to the patient? Is it that there's actually not money to support running the test itself? Is it that it's cost to the whole health system, and so policies dictating that it's not, shouldn't be covered? And so we need to unpack this may vary from region to region a little bit. So we need to probably unpack a little bit more what people really mean by cost as a barrier. But the other top four barriers were with the turnaround time. And so can we get this done in a timely fashion so that it can actually be not delaying treatment and be used in treatment selection? The sample quality, I mentioned that on the previous survey, sample quality was an issue. So if we're going to do a biopsy, collect a specimen, we want to make sure that we do everything we can to get the results that we need from it. And so there's still some issues around that can be improved, and that is still a barrier for some people to get timely testing. And in general, access, not everybody has access to that level of care, and awareness is still a top 5 barrier. So we have some work to do in terms of trying to address these different barriers. Diving into awareness a little bit with a few more questions, we ask what testing protocols their institution used, and what guidelines were they using to model their practice. And 54% said they used the CAP IASLC AMP guidelines at their institution. That was good. 26% though said they were not aware of any guidelines, and 21% said they use guidelines, and there are some other ones, not necessarily CAP, AMP, ISLC. So I think in particular, the 26% that are not aware of any biomarker testing guidelines is really an area where we could disseminate some tools that we already have. So we know that these guidelines are helpful and exist. And in fact, one thing that's currently being updated is the CAP AMP ISLC guidelines. And so those are actually out for public comment right now on the ISLC website. And they have been revising those this year. We also found that 16% of respondents said they had received no additional training since their medical training on NGS testing. And so there's an opportunity there to make sure everybody gets additional education, because we know that this NGS field moves rapidly, and the next generation sequencing is something that we could all probably use updates from time to time in our education. So some solutions that we are looking into, the survey, the respondents identified implementing testing protocols as a potential solution to help the process. The government level interventions, if we can intervene at the higher level to make sure that we optimize reimbursement and what's paid for, and finding other ways to address the cost and the reimbursement process were mentioned as potential solutions. Awareness and education also came up a lot in the solutions that we asked for, and increasing administrative and organizational support. So how can we find ways to streamline the process and help support clinicians in the process of making this actually happen within their practice? And then finally, access and availability is still, expanding access and availability is still a key solution that we need to implement. So ISLC is undertaking some work to try to implement some of these solutions, really starting with World Lung, where we started this awareness campaign by just pushing these survey results out with one-page flyers and trying to promote the results of the survey. And again, we'll be disseminating the results of the survey in multiple ways, with the regional specific results and forthcoming manuscripts, and just trying to kind of spread the word about where we are and feed whatever information we have, hopefully, into the system, so that we can take multifaceted approaches from multiple people trying to find solutions and solve these problems. In terms of access and process, the IASLC Partners for Thoracic Care, which is an industry-sponsored group that sponsored this survey, as well, is sponsoring a new project where they're actually going into multiple cancer centers and doing a deep dive on testing processes and barriers, and trying to understand how this could optimally work at a process level, and really a deep dive. And so we're working with the group that's doing that work to try to use the survey results to inform what they're doing. Hopefully their work will help us understand the survey results better. And additionally, that group is working on a potential consensus statement, or supporting a consensus statement on sampling. And so we're going to try to help improve the quality of the sampling by making sure everybody at least understands sort of an optimal process for sample collection and processing, to try to potentially address that barrier. And on the policy level, IASLC has also launched a global policy committee. So Global Policy and Partnerships Committee, which is also part of the initiative to try to do what we can to encourage change and improve.